Today we will study about the Turner syndrome. Turner syndrome is also known as Ulrich-Turner syndrome, gonadial dysgenesis, monosomy X, 45X, 45X0, congenital ovarian hypoplasia syndrome. The name of Turner syndrome is came after the Henry H. Turner, who discovered this condition in 1938. This syndrome affects about 1 of every 2,500 female live births worldwide. It is a sex chromosomal abnormality found only in a. Now we will discuss about the cause of the Turner syndrome. So Turner syndrome is occurred due to the non-disjunction in the meiosis, and that non-disjunction is responsible for causing the monosomy of the X chromosome. Here in this diagram you can see that karyotype for a Turner syndrome. So the patient who has a Turner syndrome consists of the 22 pairs of autosome and single X chromosome instead of the pair. As a result, their diploidy number is 2n equals to 45. As we know that the normal healthy human being consists of the 46 chromosome, that is 23 pairs. Out of these 23 pairs, 22 are autosome and 1 is a sex chromosome pair in case of the female XX and in case of the male XY. So in the Turner syndrome, the patient only consists of the single X chromosome and therefore their 2n number is 45. Out of this 45, 44 are autosomes and the 1 X chromosome. So non-disjunction in the meiosis is responsible for the formation of this Turner syndrome in the female. As we know that during the process of gamete formation, there is a meiosis process takes place. As a result, 4 gametes are formed. But due to the non-disjunction, due to the failure of the homologous chromosome to the separate, as a result, the one gametes will contain the both sex chromosome, while other gamete does not contain the any sex chromosome. And when this type of female gamete which having a no sex chromosome will mate with the male gamete having a X chromosome, leads to the Turner syndrome. So let's see what are the signs and symptoms of this Turner syndrome. Number first is the short statures. So the female who has a Turner syndrome, their height is short. Then there is a swelling of hands and the feet. Their chest is broad. Their hairline is low and they have a low set of ears. They are reproductively sterile. There are rudimentary ovaries are present in them. Then their uterus is small. There is a poor breast development. There is a visual defect, ear infection and the hearing loss. And one of the characteristic feature in Turner syndrome is a web neck. There is a fold of skin found in the neck which is called as a web neck, and that female shows the absence of menstrual period. So these are the signs and symptoms found in the patient who has a Turner syndrome. So how the Turner syndrome diagnosed? Before the birth of the baby, Turner syndrome may be diagnosed by the amniocentesis and chorionic villus sampling. Sometimes fetus with the Turner syndrome are identified by the abnormal ultrasound finding, for example, heart defect, kidney abnormalities, and karyotyping is also used for the analysis of the Turner syndrome. As we know that this is a chromosomal condition, so there is no cure for the Turner syndrome, but their symptoms can be minimized. For example, hormone replacement therapy such as growth hormone may be used to increase the growth. Estrogen replacement therapy can promote the development of the secondary sexual characteristic. So this is all about the Turner syndrome. If you like this video, then please subscribe for the more.